Welcome back. We know that the Medicines Act allows you to use and possess marijuana and the specific THC cannabinoid known for its psychoactive effects in private. Yet there are a number of people who sell the drug either for recreational or medicinal purposes, which is currently against the law. Now, to date, no licenses have been approved for the manufacturing of medicinal cannabis in South Africa. For more on this, I'm joined in studio by Momeena Omarjee, Head of Names and Scheduling Unit at the South African Health Products Regulatory Authority. Momeena, welcome to, and thank you so much for joining us. In February 2018, last year, the Medicines Control Council was replaced by SAHPRA. In terms of what you've had to deal with, just taking from the work, the handover, what is on your handover plate?
So currently we changed from the Medicines Control Council to the South African Health Products Regulatory Authority, or SAHPRA. So the mandate remains the same and the activities remain the same in terms of ensuring and maintaining the quality, safety and efficacy of medicines and medical devices in South Africa. A few processes have changed in terms of registration to increase efficiency in the registration procedures, but the mandate and the activities remain the same.
So no licenses have been issued or approved for the manufacturing of medicinal cannabis, and I know that you had 95 license applications and only 5 made the grade. Why is that?
So we've issued 5 positive recommendations, just meaning that they are compliant with the guidelines and the policies set out for the cultivation of cannabis. There are currently no registered cannabis-containing medicines in South Africa, and therefore no companies have been allowed to manufacture them because there's no products that have been registered in South Africa. In terms of the 95 applications that we've had, 45 have already been inspected and in the process of verification and secondary review, and the other 50 are in the process of being scheduled for inspections. But at the moment, 5 have made the grade for a positive.
And what does it take to make the grade?
It's quite a rigorous process. You have to go through an application process and follow the guidelines that are available on the SAHPRA website in terms of determining the quality, safety and efficacy of the cultivation process, and if you want to manufacture, then of the manufacturing process as well. But it does entail quite a rigorous process, and we are working in collaboration with the applicants for the licenses of the cultivation and the manufacturing as well.
And when it comes to legislation, are we going to see any legislation regarding medicinal cannabis anytime soon? I mean, there was a lot of excitement when, it was now legalized and, marijuana was accessible to all without a criminal charge. And now, those wanting to venture into the business of medicinal cannabis seem to be encountering a lot of red tape.
So, in effect, what the Constitutional Court judgment did was it effected the decriminalization of the possession, the use, and the cultivation of cannabis by an adult in private for one's own personal consumption. What that didn't translate into was the sale of CBD or THC, which is the cannabidiol or the tetrahydrocannabinol products, to the public, manufactured from your own cultivated cannabis, if I could say that. The Medicines Act does make provision, and the schedules does make provision for access and prescribing of cannabis-containing medicines. So if a product is registered with SAHPRA that contains cannabis, the public does have access to these medicines. Unfortunately, in South Africa, there are currently no registered or marketed cannabis-containing products in South Africa. But again, there are provisions to access these medicines via a Section 21 pathway.
So it sounds like a very complicated process. What process do you have to go through to go get your product registered then?
As with all other medications in South Africa, you've got to follow the application process or the registration process via SAHPRA. And then again, it is to determine the quality, safety and efficacy. So all the necessary documentation that one would require to evaluate a product for quality, safety, efficacy, to ensure the safety of the public has to be provided to SAHPRA. And again, everything is available on the SAHPRA website. There are guidelines, there are application forms, and they are all available on the SAHPRA website, which is www.sahpra.org.za.
Now, in terms of at a legislative and policy level, looking at SAHPRA's key objectives, what exactly do they entail?
Sorry, could you repeat that for me?
Just looking at your key objectives on a legislative and policy level.
In terms of cannabis?
Yes.
So again, it's to ensure quality, safety and efficacy medicines are going out to the public that have been evaluated accordingly to those principles. And that is the main focus of SAHPRA at the moment in terms of getting those products out to the public.
You know, there's been a lot of, you know, solutions, you know, when it comes to herbal medicines and people opting for them. And medical cannabis has seemed to be hugely and highly beneficial. You know, in terms of the research that's been done into medicinal cannabis, is the research substantial enough to show that it offers huge relief, for instance, for people who may be feeling a lot of pain? Is that all substantiated?
Currently, there is a lack of clinical evidence on the use of CBD in a lot of the claims that are being made out there. But there are products that are available, not necessarily in South Africa, but globally. One, for example, has just been registered in the last maybe 8 months to a year by the FDA, which is Epidiolex. And that's a CBD-containing medicine which is used for a very niche pediatric epilepsy in Lennox-Gastaut and Dravet syndrome. We also have Sativex, which is also registered globally, which can be used for the symptoms of multiple sclerosis. There are other products, in dronabinol, which can be used for chemotherapy-induced nausea and for pain in certain instances. As I said, there is a lot more research that needs to be done in terms of the other claims that are being made, but currently those are the 3 indications that where cannabis or cannabis-containing medicines are used.
And how do you know what makes a good medicinal marijuana product?
So if I could just go back a bit, if you allow me to say, the Minister of Health in May of this year published an exclusion notice that effectively excluded certain CBD-containing preparations from control of the schedules. What this entails with specific criteria. What this translates into is that there are certain products out there that can make very general health claims, so not claiming to treat or to cure a disease or a symptom, but a very general health claim assisting with restoring balance. And also it needs to have a maximum daily dose of 20 milligrams or less. Those complementary medicines are allowed on the market for sale, but they also have to abide by other regulations and other requirements in terms of manufacturers and importers of these products and licensing requirements with SAHPRA. A secondary caveat to that exclusion notice was the allowance of a negligible quantity of CBD or THC in processed products that are also excluded from the control of the schedules, but again, making non-medicinal claims. So there needs to be no medicinal or even therapeutic claims attached to those products. So those are available for sale, but they've got to abide very strictly to the criteria and the requirements that were set out either in the schedules or the exclusion notice that was published.
You spoke earlier on about a huge number. I think you said 5 of the licenses, of the license applications that you've seen, only 5 make the grade. And you spoke about a bulk, 45 of them that are also under review. In terms of time frames, what time frames are you looking into those to ensure that perhaps, you know, there's some movement around those people who are eagerly awaiting to move with these products?
That is generally time dependent. That is generally dependent on the application that was sent through by the applicants. Dependent on how far along they are in terms of compliance with the requirements, each applicant or each application is taken on its own individual merit. So it's rather difficult to say at this point in time, because it is a fledgling pathway that we are taking as SAHPRA. And South Africa. And
you know, for the eager consumer who knows a little bit about the benefits of using medicinal marijuana, what are some of the warnings that you'd like to send out there in terms of the products and landing? I mean, I've seen a cannabis drink. I've seen all sorts of products since this law was passed. What are some of the key factors that you think are highly essential for consumers to be aware of?
What SAHPRA would like to inform, what SAHPRA is really concerned about, is the disingenuous marketing that's out there of the products that are out there. We would like to inform the public that if they want to use a cannabis for medicinal use, rather go the legal pathway and get a unregistered cannabis-containing medicine via the Section 21 pathway, or to try and use a product from a licensed manufacturer who's making it within the realms of the exclusion notice as well. So please stay away from any products or CBD oils that are out there that are making outrageous claims in terms of treatment and curing diseases and symptomatic diseases as well.
Thank you so much, Momeena Omarjee from SAHPRA. Thank you for your time.
Thank you very much.
We now move to